I'm Mayor Joe Winfield. The last few months have been difficult for all of us, and we're dealing with this the best way we know how, by social distancing, wearing a mask, washing hands. These are all necessary actions to minimize the spread of COVID-19. One question I've heard lately is, when are we going to open our businesses and revitalize the economy? I understand the urge to flip those closed signs around to read "Open for Business," but we have to keep in mind that COVID-19 is not going away. Scientists are researching and working on vaccines. Until then, we need to remain diligent to do what we can to slow the spread. While COVID-19 is a serious public health threat, most people who have been diagnosed with COVID-19 have recovered. But if we're not vigilant, it could overwhelm our healthcare system. The Centers for Disease Control, or CDC, has recommended a three-phase approach. The first component, which the CDC refers to as gating criteria, are three benchmarks that need to be met before proceeding to phase one. Those benchmarks include data for symptoms, cases, and hospitals. For symptoms, the CDC wants to see a downward trajectory of influenza-like illnesses reported within a 14-day period, and a downward trajectory of COVID-like syndromic cases reported within a 14-day period. Our healthcare industry is studying this pandemic in real time. Right now, there are estimates that for every person who exhibits symptoms, there are 50 to 80 people who are asymptomatic. That means a person with COVID-19 could transmit it unknowingly. That's why hand washing, social distancing, and wearing masks in public places is vital to protect others. The CDC would like to see a downward trend of documented cases within a 14-day period, or a downward trajectory of positive tests as a percent of total tests within a 14-day period. In Pima County, the trend is still continuing upwards. The latest projections show we are still a week or two from the peak. Remember, we need to see 14 days of a downward trend. The final aspect of the gating criteria is for hospitals to be able to treat all patients without crisis care and have a robust testing program in place for at-risk healthcare workers, including emerging antibody testing. That's why all the donations and volunteer efforts to provide personal protection equipment to our healthcare workers are so critical. And to all of you who have donated or have created these materials, thank you. Once those three criteria are met, the recommendation is for a phased comeback that helps prevent a rebound of COVID-19. For now, we will continue to monitor our local data and follow the governor's recommendations, which align with the CDC's recommendation. This will help our community, our economy, and it will help our healthcare workers. We need to do this together as a community. We need to do this to protect our vulnerable populations, and we need to do this for our healthcare workers and first responders. We need to remain diligent. Stay strong, Oro Valley.